Hello everyone, my name is Timothy Oyelaki from Center for Health Economics and Development, also a supporting TA to Federal Ministry of Health and Social Welfare. I'll be taking you through the video on how to populate the Performance Monitoring Plan, which we also call the PMP. The PMP is the operational module in the AOP, which is gotten from the Monitoring, Evaluation, Accountability, Research and Learning Plan, which we call the MEL plan. And this one MEL plan is expected to be implemented at all levels of the healthcare system. And as we know that the HSSB helps to achieve the SWAP principle of one plan, one budget, one report, and one conversation. So this MEL plan is the M&E for tracking and measuring performance of the HSSB. Also, the accountability, research, and learning around the HSSB implementation. So the one MEL plan will help us to deliver the one report to inform one conversation in the spirit of SWAP. So we also need to know what the level of strategy and level of results are. I'm looking at the HSSB and the MEL, which is the MEL plan. So at the goal level of strategy, what we are measuring is the impact. And for the objective, we are measuring the outcome. For the priority initiative, we are measuring the intermediate outcome. At the intervention level, we are measuring the output. And for the activities which are operational, we are looking at the inputs, we can call them the milestone. And these results, just like we have highlighted here, will be tracked through performance review, through evaluation. For the short-term reviews, we'll have the facility or LGA reviews, we'll have the AOP reviews. We also have the joint annual reviews. Then also, for the medium or to long-term evaluation, we look at the MTR, which is the midterm review. Then also the end-term review, which ultimately we can look at the also look at the impact evaluation. It's also very important to know that the indicators we have in the MEL plan is at the input, output, intermediate outcome, and the outcome level. And the indicator tracking reforms in health system structures, the processes, and the outcome. More importantly, you need to know that we have some indicators that have been developed for the ongoing health investment initiative, like the HSSB Health Sector Renewal Investment Initiative, like the SWAP, the OPDLI, the MAMI, the BHCPF, even the presidential deliverable. These indicators have been profiled against the strategic interventions of the blueprints. Then also these indicators are tracked monthly, quarterly, annually, as the case may be. Also at the facility level, the LGA, the state or FCT, and also at the federal level. More importantly, we need to know that there are some color codes that has been used to differentiate the different level of results. Like for the green color, we have the objective, the yellow, we have the priority initiative, the blue, we have the intervention. Then for the orange, just like I mentioned, the priority programs that are ongoing, we have that to specifically highlight those indicators. Okay, so and the PMP, like I mentioned, we have on the two, there is an indicator matrix that has been developed to explain better what these indicators are. Just as you can see, we have the different color codes that I've mentioned, the green, the yellow, the orange, then the blue. So these indicators have been mapped to the objective, the priority initiative, the intervention. And as you can see, we have the column for the HSSB code, just like we have in the AOP. We have that. We have the column for the objective, initiative, priority initiative, and intervention. We have the intervention description here. Then we have the indicators that have been mapped to this intervention, to this priority initiative, and the objectives. So as you can see, this indicator matrix has indicator name, the definition to define what the indicator actually means, the level of result at which we are tracking them, the source of the data for some of them that are HSSB in yellow, the ones that are in orange, like I mentioned, you can see the presidential deliverable here. You can see the health sector renewable investment initiative core indicators. We have the swap core indicators. We also have some other, you can see for the MAMI and so many. We have the JAR resolution tracker, and we have those indicators mapped to the interventions, the objective, and the priority initiative. Then we also have the frequency of measurement. We have the method of measurement. For example, this indicator is percentage of states that utilized the national guideline for the conduct of their SCH meetings. SCH here is State Council of Health meetings. You can see the method of measurement here because it is in percentage. We're having the numerator and the denominator. So it defines what the numerator is supposed to be and what the denominator is expected to be. And where can we get this data from? The source of data or the means of verification, the data collection method, the responsible entity, and the level of reporting. So as you can see from the title of this indicator, we can see it's a federal MEL plan indicator. So what we can see now is we have state level MEL plan indicator metrics and the federal level MEL plan indicator metrics. The state level has just state specific indicators that the state is expected to respond to, and federal level has federal level or national level, as the case may be, for the agency responsible indicators. Then also the use of indicators here, we have the ones that are used monthly, quarterly, for the state joint annual review and the national joint annual review. More importantly, we also need to know that we can use these indicator metrics to do our SWOT alignments, to select the priorities, the interventions, priority interventions that we want to implement for the planning year. Then also, the last two columns here is where this indicator metrics is really very useful for baseline and target setting. I will talk more on that as we proceed with this indicator. So let me give an example of one of the indicators that is federal level. So for example, we have something on percentage of AOPs with LGA Health Facility Plan consolidated. Here, as we can see, this indicator is looking at the total number of AOP across these different level, as we can see. Then we have some other indicators there. We have proportion of states that develop their AOP in collaboration with relevant stakeholders with the required TA needed. So you can see, if we are to report this for the federal level, what they are doing is to aggregate the number of states that have done this. But when you get to the state, what you are going to see is whether the states actually develop their AOP according to what this indicator is saying, or they did not. So theirs might be a yes or no response, while the federal MEL plan will now aggregate the number of yeses to get the number of states that have developed. So for example, if we are using this indicator, for example, so the proportion of states is being defined here. It's an output because it's mapped to an intervention. It is done annually. So this method of measurement helps probably the program officer or the M&E officer to know how to define this indicator and also report it. So we can see it is from the AOP. It is expected that the states submit their AOP, which can also be used to verify if they've actually done their AOP. And also it is a national level indicator. So what we are to do here is to, if this intervention was SWOT map, by clicking one, once you select one, it helps you to select what the it means that intervention was selected, was prioritized. What you have to do here is to select to put the baseline. The baseline is as at the end of the year preceding the planning year. For example, if we are planning for 2027, the baseline will be as at the end of December, the end year 2026. That will be the baseline. So let's say, for example, the 30 out of 37 states and FCT, 36 states submitted. For example, 36 states. What you are going to type in this baseline as at 2026 will be 36. Yes, but don't forget that what we are tracking is percentage. So we'll now say 36. So based on this method of measurement, you will now divide 36 by 37 to get the percentage of number of states that actually submitted. So if I want to use that using my Excel to know the percentage, I can say 36 divided by 37. Yeah, you can do it manually using your Excel or your calculating tool for you to see what the percentage will be. So you can see this is giving me 97.3%. That is as at 2026 end year. What do we want to get at the new year? That is the annual target. We expect that everyone submit their AOP, all the 36 state and FCC. So here we will say our target is 100%. So you can see, very easy. If you're able to follow line by line, you'll be able to get what the indicators are reporting. Now let me go to state. For state, like I mentioned, the states also have the similar structure like we have in the federal, the way it's been defined, the indicators. Then also, more importantly, you need to know that there are some interventions that has more than one indicator mapped to them. As you can see here, this is 2 indicators mapped to this one intervention. And also you can see here, we have about 2 here too. We have 3 here. So those were in the intervention indicators rather that were mapped. So you can see, just like I was mentioning, the same indicator in the federal level MEL planning matrix is what we are seeing here at the state level. But this time around, they are reporting whether they developed or not. So you can see development of AOP in collaboration with relevant stakeholders with the required TA needed. So you can see here, the state is just to respond whether it is what? We've done it or not, which will be 1, yes for 1, and no, which will be 0. So here in 2026, as I heard of 2026, if it was not developed, it will be 0. But what should be our target? Our target is that we develop it, which will be what? 1. Yes, 1. So, and that helps you to have that information. So, yeah, so this is not supposed to be a percentage. It's supposed to be a number. So more importantly, you need to pay attention to what the indicators are measuring so that you can know what you have to respond to going through the indicators. Yeah, so now we need to go to the AOP and see how this is being reported. So once you are able to finish reporting the baseline and target on the Excel, which is the indicator metrics, what you just need to do is to come to the PMP. So for the PMP, everyone have access to seeing the PMP module in the AOP. Yes, so let me give an example for, this is Abia State. For Abia State Ministry of Health, when you come to your AOP, you will see that on the planning matrix, the indicators are showing here. You can see, look at these indicators, they are showing. And also, even for the PIs, the Priority Initiative, the indicators are here. But how will you know what your baseline and target is? You have to come to the PMP. This is where the PMP module is. The PMP has those indicators that have showed us in the Excel. You can see them here, right here. But one thing that you need to know is that you might not be able to populate the baseline and target as a user. The only person that can do that is the state admin or the federal admin. How do you do that? So the state admin is the one that can see this module here, this PMP here. So once you click the PMP here, the state admin will come and you will see the pencil where you can populate the information. A user won't be able to do that. So for example, the information that I shared earlier, the baseline and target that we populated, we can see here that the indicator, you can see we have them in different pages and sheets. So the person that will populate it, which is the state admin, will come here and locate the intervention code. And once he's able to locate the intervention code, he will be able to come here, you can see here, and populate the baseline and the target. So you can see for that specific indicator, you can see here, data source will be the developed AOP, data collection method, document review, frequency of reporting annually, responsible DHPRS, baseline just like we had 0, then the target 1. Once you are done with this, you submit. What will happen is that the figure you populated will now show in your AOP, that is the planning matrix. Then it will also show in your PMP. So it gives you an information. So it is expected that the state admin, which we actually encourage that the M&E officer should be the one, because they are very more familiar with the data reporting system. It helps them to get this. So you can see here, so if you go to the planning matrix, you see this. Then for the federal also needs to, we can also do this, the same process. The federal also have that on the on their AOP, but when you come to the PMP, you have the information here, just like I did for the state. You populate where the indicators are, you put in the figures there, then you are able to see the baseline and the target. So this is very important, because if you don't do the baseline and the target, when the planning officers are planning, they won't know what they are working towards, what they are expected to measure. And more importantly, the performance review, which is expected to be done quarterly, we will now be looking at how far have we been able to achieve those targets that you set for the year at the end of the quarter. And this will help you to be able to have a better measuring performance, indicator that gives you a progress of how far you have gone. So on this note, I would like to say thank you for going through this video, and we know that you are going to have some questions. Kindly reach out to us via the forum to answer your question. Thank you.